going to walk out of here with a lot more knowledge and a lot more empowerment about your own instrument. I want to thank Dr. Jonathan Talbert, as the voice and choral areas are co-sponsoring this seminar. Dr. Jonathan Talbert.
Thanks. Thank you, Dr. Hahn. I talk a lot about beach family and choirs, and so when Dr. Elizabeth Schumann, I call her Biss, and all of her friends and family call her Biss, reached out to me and said, I'd love to come and just share with the beach community. I said, of course, we would love to have you do that. Elizabeth's going to tell you all about her journey, or a little bit about her journey. But let me tell you that when I walked in today, the first thing that I said to her is, so are we going to New York? Because her best friend, one of her best friends, just announced this morning that he's doing a lead at the Met this year. And so I think that's the depth. What's that?
I said, duh, we're going.
So duh, we're going. So that's the depth of the voice, of the love of this program, and her understanding. I think it was really from growing up in a family of singers and medical professionals that she was able to really kind of put this career together. And it's, as I mentioned to university choir yesterday, it's a long road to becoming a doctor with the specializations that Biss has. And then I just met Casey, who's here, and there's a voice pathologist specialist. And so I'm just so excited that they get to share with you and that we get to welcome them back to Cal State Long Beach and Elizabeth's case. And please give them a big, fat, warm welcome.
Are we on, Marcus? Oh, perfect, thanks. Thank you so much. I am so honored to be back here. I gotta tell you, I have been on the stage. I've been right where you were. I was here for my undergraduate study in voice between 2005 and 2009. I know that probably seems like a long time ago. That was actually when the first iPhone came out. So, just to give you a little bit of a historical perspective on that. But I'm very honored to be back. As Dr. Talberg mentioned, my time here was life-changing and transformative. And although my career path has been a little bit unusual, so to speak, it has been really rewarding, and I'm really honored to be here to share some of my knowledge and Casey's knowledge with you. Let me start off with some definitions. Casey and I work very closely together. We see patients together, we work in the same office every single day, and so we're like this, we're a package deal, we say, and we'll go into a little bit about why. So first of all, what's a laryngologist? Sounds great, right? It is a subspecialty within ENT. So I am a board-certified ear, nose, and throat doctor, a head and neck surgeon. I have additional training in the specialty of around the larynx or the voice. So we manage voice, swallowing, and airway problems medically and surgically. I take care of singers, and that's a big part of what I love about my specialty, but I love also the breadth of what I get to take care of. This is voice problems that are not related to singing, life-threatening airway narrowing and scarring, cancer, swallowing disorders, so a very broad spectrum of disease. And so I love going to work every single day. I love being an expert in the organ of voice and swallowing, and I couldn't do what I do without Casey. So I'll let Casey tell you a little bit about what she does.
Yeah, so a voice-specialized speech-language pathologist is a subspecialty also within speech-language pathology, which requires a master's degree. Everybody who does a master's degree in speech pathology does a fellowship. So it's different than a physician who decides to take on an extra year. You do an extra year of training whether you like it or not as a speech pathologist, but you can apply for various different areas of speech pathology. A lot of times people think of SLPs as working in the schools, helping kids with articulation disorders, or you can be on the medical side treating anything from like infants in the NICU to end-of-life care. So voice specialized SLPs do work with a lot of singers and professional voice users, including like fitness instructors, teachers, people who use their voice a lot for a living, but also treat upper airway problems like chronic cough, chronic throat clearing, other things, and I also dabble a little bit in swallowing. So,
and anything that does not require like medicine or surgery, Casey is who you want to be seeing. And I love being able to help diagnose and treat these issues, but Casey and I work very closely together because so many of the issues that we see can be managed with a behavioral lens, and that's super important. I put these slides together just for fun. These were pictures from my time here. Actually, there's a couple here in Daniel Recital Hall. This is Eddie, actually, who Dr. Talbert was talking about, Edward Nelson, who's having his lead premiere this year. And I met my husband here, too. We met in choir. I stalked him, and I tried to get him to teach me piano lessons. And here's Alex Schenk, which I'll talk about her in a second, too. I told John I was going to share some old-timey pics. I took this pic when I was in high school. I'm just telling you, we go way back. I met John when I was in high school, also a choir nerd in high school. I went to Arrowbear Music Camp where I met John Talbert, which ultimately led me here. And then also, Christine just walked in. Christine was one of my voice teachers here. She has also changed my life and my perspective about voice and music and art and life. And so just big love to everybody here. So enough of that. We'll move on to why we're actually here. Wanted to take a moment, as John mentioned, to talk about our path as sort of a career day slide. Don't do the math necessarily, because then you'll know how much older I am than Casey. But essentially, here's like kind of a summary of our path to get here. The top one is sort of how you become a laryngologist like me. 4 years plus of undergrad, and assuming that you didn't do a science degree, you do have to do some prerequisites. I had to do 2.5 years of a post-bac program, which I did at Cal State Fullerton. In pre-health professions that helps gear you up and prepare you with the medical requirements or the pre-med requirements for medical school. I did medical school at UC San Francisco, and that was for 4 years. 5 years of ENT residency, that's most programs, some are a couple more. And then an additional 1 year of just focusing on the medical and surgical management of issues involving the larynx, and now I'm a laryngologist. And then I'll let Casey take you through her journey briefly.
Yeah, so I did not study communication disorders as an undergrad, so I did do it's like 5 semesters, so just a little over a year of a post-bac program to take the sciencey credits to get into a speech pathology master's program, and then I did a 1-year fellowship at USC with Dr. Schumann, and then I became a voice specialized speech language pathologist. And this picture is here on the end because we actually were fellows, so we completed our training the same year, and then we're very fortunate enough, it's very rare to stay on with your fellow, so that's why we call ourselves a package deal.
Yes, we are. And I'm so grateful to work with Casey so much. And I also wanted to give a quick shout out to Alex Schenk. She was a year behind me. She was in the opera studies program, amazing singer. This is a picture of us singing in Rome. Actually, here's John conducting us. And she went on to, like Casey, become a voice specialized speech language pathologist. She was a fellowship mentor to one of our colleagues, Felicia Francois. So we see her at conferences and we get to talk shop a lot with her, which is so fun. So this is a very, it makes total logical sense to me that I got to laryngology and I think voice specialized SLP, and even though it's not necessarily a traditional path. So you can do it too, and it's really, really rewarding.
Yeah, I will say the pipeline from singer to voice specialized speech language pathologist or laryngologist is a really real thing. I did not study music in undergrad, but I am a musical theater kid at heart, and so that kind of inspired my reasoning for wanting to do voice.
Great. All right, now on to why we are here. Our plan is to do little slide stuff for about an hour, and then we'll do a quick demo to look at the vocal folds live on the big screen, and then we'll have plenty of time for questions. So keep track of your questions. I totally want to answer them. So we'll take you through a couple things. First, how the voice works, what we do, and Casey's going to talk about keeping your voice healthy, and then we'll talk a little bit about pathology, what happens when things go wrong, and how we can best manage those things. So first, that voice care is a team sport. So the singer or the patient, whatever you'd like to call the individual with the voice problem, is the center of our world. And it used to be thought that the doctor was the top of the food chain and blah, blah, blah. No. The patient, the singer, is in the center of our care model. You have a team. You have a laryngologist. You have a voice specialized speech language pathologist. You have your primary care doctor who manages chronic health conditions. And also you have a voice coach and voice teacher, somebody who knows your voice, somebody who knows your voice journey, what struggles you have, what your baseline voice is like. So we all work very closely together, and we work hard to communicate with all members of this team as we take care of somebody with a voice problem. Because it is a team sport, I'll just a quick plug for our team. At the USC Voice Center, we have 3 fellowship-trained laryngologists, Dr. Michael Johns, Dr. Carla Odell, and myself. We have a laryngology fellow, Dr. Morgan, and we have 4 voice specialized speech-language pathologists and a voice SLP fellow. Erica helps with all of our patient navigation concerns. So if you come see us, you'll meet some of us, no doubt. And we all kind of work together as a big team. We believe strongly in the interprofessional model. So traditionally, you'd kind of go see a doctor, a voice maybe ENT doctor, whatever, get scoped. They'd send a note to some kind of maybe unfamiliar SLP somewhere else. Communication breakdown, not best for patient care. We believe strongly that we need to see these patients together. If you come see us, you'll see me and Casey in the same room at the same time, looking at the same vocal folds, the same history, and we believe that that really is how we can best take care of our voice users. So we believe strongly about that. That's our bias. It's not how care is delivered in a lot of places. A little bit about how the voice works, shifting gears to the best. This is my favorite video of all time. I'm going to play it just for you first, and then we'll talk a little bit about what we see. Gorge. Is it freezing?
It's freezing.
Oh, darn.
They're going like this.
Yeah, here, we'll
There
start
we
it
go.
over, though we don't have buffering issues. Oh, yes, there we go. These are the vocal folds. This is where the magic happens. So this is an example of a high-definition video stroboscopy. This is kind of how we look at the vocal folds in our clinic. This can be done through the nose or through the mouth. It gives us a slow motion appearance of how the vocal folds are vibrating. When you're singing like an A440, that means the vocal folds are vibrating 440 times per second. That's faster than we can see with our eyes, so we have to use a strobe light to deliver an out-of-phase strobe to allow us to see this like illusion of slow motion and vocal fold vibration. Also important, this is probably the biggest screen I put vocal folds up on before, but important to know that your vocal folds fit on your thumbnail. They range in size from the diameter of like a dime to a nickel. These are tiny, but huge. I mean, right? Like, can you imagine something so small having such a big impact on your identity, on your livelihood, on your communication abilities? It's really remarkable, and again, part of the fascination that drives our passion for this. So of course, voice is a big part of this. Also, the larynx has these important functions of breathing, swallowing, and airway protection. From an evolutionary standpoint, important to protect things from going down into the trachea and lungs by closing, and voice is sort of evolutionarily secondary. So it's important to think about all those functions. Little anatomy refresher. You may remember this from vocal development. That's a course here, which I loved. This is the laryngeal skeleton. There is a bone at the top of the skeleton called the hyoid bone. It's the only bone in the body not connected to another bone. Fun fact. It suspends the rest of the cartilages of the larynx like a hanger, and it's suspended by ligaments. There's the thyroid cartilage, which you can feel sort of the Adam's apple is this thyroid notch. Down below is the cricoid cartilage, which is the only complete ring as part of the airway. And then down below is the trachea. On the back side, you'll see the arytenoid cartilages. These are like little pyramids that pivot to open and close the vocal folds. There's tons of muscles, and again, these are very, very tiny muscles, but very important in vocal fold opening and closing, coordination, swallowing, and important that all of these are innervated by a nerve that travels from your brain around your heart up back to the larynx. Also important to note that while the tiny muscles that control opening and closing, the larynx does not sit on an island. It's controlled and suspended also by tons of other muscles in your neck. Neck strain can really contribute to muscle tension problems and voice problems of residents. This picture here, I joke, is the laryngologist's favorite picture. This is if you were to take a vocal fold and take a cross-section. Down below is this cross-section of a muscle called the vocalis, or the thyroarytenoid muscle. And the way that the vocal fold functions is highly critically important and dependent on how these layers function. So there's this like thick muscle that you can control. You can open and close them volitionally. Then there's these layers of sort of gelatinous vibration covered by a layer of skin or epithelium that allows the vocal folds to vibrate and vibrate at whatever pitch that you've trained them to do. And then you'll be able to see this better now that you know a little bit more about it on this video. Again, hopefully it buffers better this time. So you can see that propagation of the vocal fold vibration occurs over the whole top of that vocal fold, and it's not just a two-dimensional structure, right? This is a three-dimensional structure that's happening in real time. So we have some terms. Adduction is when the vocal folds are placed together, adding together, and abduction is when they're opening apart. Abducted by aliens, how I remember it in medical school. So adduction, added together, abducted, far away. So opening and closing, important for breathing, voicing. As we're talking, we're using voiced and unvoiced phonemes all the time, so our vocal folds are going like this constantly, and you'll see as we do our little demo how that works. Pitch increase happens by a various number of mechanisms. I'll give you an example. These are my vocal folds, actually. So to increase pitch, you'll see, like a string, if you increase the tension, the pitch goes up. The length has a secondary effect, but really tension has the biggest impact on vocal fold pitch change. And this is going down in pitch. Oh, this is again, sorry, decreased pitch. Decreased pitch, same thing you'll see as the pitch descends, the tension goes down on the vocal folds, the vocal fold vibration happens more slowly. Yep, exciting. And the pitch change happens by a variety of muscles, but also by the cricothyroid muscle, which approximates the thyroid cartilage and the cricoid underneath to tighten or loosen the vocal folds. How do we generate sound? You may have heard of this in vocal development too. This is the power vibration resonant model. So yes, the vocal folds are super important and they do generate the pitch, the fundamental frequency that you're generating with your voice, but that can't happen without power. The power happens with your lungs, airflow. So the whole thing, like breathe from your diaphragm, we take that with a grain of salt, but important to have a lot of air coming down up from the lungs to generate pressure and train vocal fold vibration. And all of that vibration is then modulated and expanded by the resonator space. We'll go by each one. So again, the lungs are our power source for our voice. If you don't have an adequate breath, if you have issues with taking a deep breath, this can create vocal problems in and of themselves. The vibration source we talked about. Here is a little cross-section of how the vocal folds vibrate by Bernoulli's principle. We can talk for hours about this another day. But here's a little GIF that gives you an idea of the cross-sectional vibration of the vocal folds as they vibrate. So we go from like lower to high based on subglottic or below the vocal folds air pressure coming up. And then as I mentioned, the resonating cavity is all about speech, articulation, and magnification of the vocal folds vibration to be heard. You may have heard of like the singer's formant. This is an ability for singers to utilize various overtones to be heard as more loudly than an entire orchestra. Like imagine these opera singers filling up an entire orchestra hall above like a Mahler orchestra. Like, you know, that's cray-cray. So amazing we can do that. So the upper vocal tract, important in articulation and resonance, and these are the things here, the parts of that as well, which is critically important. So the way that you hold these different structures, the palate, the tongue, the pharyngeal wall, all contributes to sound and vowel sound as well. These are kind of silly audio clips. This is the vibration alone sound, which is going to sound like a little duck. So this is just how your vocal folds would sound if it was by itself. Oops. Sorry. Rude. Okay. And then here is that same vibration passed through a resonating cavity with a particular shape. And listen for a vowel sound. Oh gosh, again. E? Could you hallucinate E for me? Okay, good. How about this one? So this is kind of helping us understand that with one pitch that's generated by the vocal folds, you can make any number of vowel sounds and different articulations. I won't take you through this video for the sake of time, but you can really see, and we'll play a little bit with the demo, that the shape of your throat or your pharynx really has a big impact on how the sound is perceived. That twang sound or a big operatic open sound, all that has to do with the resonating space above the vocal folds and not the vocal folds alone. So stay tuned. I'm going to turn the time over to Casey for some of our behavioral things. Keeping your voice healthy.
Hello. So first I like to think about this, just some food for thought for y'all. Your body is your instrument and you are a vocal athlete. So it's not the same as like someone who plays piano or trumpet or guitar where they can put it into their case and put it away for the day. Your voice, your larynx is responsible for talking, breathing, swallowing, doing lots of things at the same time, and you never put it away. So think of yourselves as very high caliber athletes when it comes to voice. Just some basics. Take care of yourselves. Eating well, staying hydrated, exercising, getting a good night's rest, and managing your stress, whatever that means to you. Just being globally healthy keeps your larynx healthy. We do sometimes dive into hydration, and there are two different kinds of hydration. One is systemic hydration. This is internal hydration, meaning you're drinking water affected by fluid ingestion and it keeps your mucous membranes moist when you're drinking lots of water. So there are lots of choices when it comes to water bottles, but just like pick whatever works for you. I get a new water bottle like every 3 months just to keep myself excited about it. So I might be, preaching to the choir here, but literally, but nothing you eat or drink touches your vocal cords. So maybe when you take a sip of water and it feels like it went down the wrong pipe, maybe then it does, but in general, we don't want it to. So surface hydration can also be really important. Surface hydration gets moisture directly to the vocal fold surface. This is things like steaming or using a nebulizer or humidifying your air when you sleep at night. So for a performance, chugging a bottle of water before you go on stage is not helping you for that performance. It's helping you for like 4 or 5 hours later. So research suggests that dehydration can negatively affect the sound and feel of your voice. So there's lots of fancy words like viscosity on this slide, but basically what it means is like if your vocal cords are like an engine, the slipperier that engine is, the more well-oiled your engine is, the less air you have to use, the less power you have to use to set your vocal cords into vibration. So I'm sure you've heard a lot about hydration, but it really is important. Just some general tips. I already said this, but don't chug it all at once. Sip it throughout the day, and don't wait until you're thirsty. So I say drink water on purpose. Amount is different for everybody. Sometimes people come to us and they're like, what is the exact number of ounces, please? And I'm like, I wish I had an answer for you, but totally depends, how active you were that day. So many different factors can contribute to how much water you need, but generally we say 2 to 3 liters of water is important. There are lots of apps, that's what these little icons are, that can help you, I tell it to my patients all the time, to stay hydrated. My favorite one is this first one here, Plant Nanny. It's super cute. If you have not looked into it, you should do it. And this is a little bit more about nebulizing with saline. So there's something called phonation threshold pressure, which is what I mentioned before. How much air does it take to set your vocal cords into vibration? It's the most well-researched thing we have to say, like, this genuinely does decrease the amount of pressure you need. So there are several different nebulizers out there that exist. I think that the Vocal Mist is sort of marketed towards singers. If you haven't heard of it, you do pay a little bit of a singer's tax if you want it, but there are also some really good alternatives on Amazon, and you can also get these little saline packs on Amazon as well. A little bit about vocal dose and vocal budgeting. Vocal dose is the exposure of vocal fold tissue to vibration, and I do want to mention that this isn't just talking and singing. Things like coughing, clearing your throat, grunts when you're exercising, if you're picking something heavy up and then putting it back down, it's all contributing to your vocal dose. So different components of this: how loud are you? How high in pitch are you singing or talking? Not necessarily one right pitch for you to be talking at either. I think I get a lot of questions like that from singers. How long are you talking or singing for? And then just different variation based on how efficiently you're doing those things. So vocal injury can be related to dosage, and I want to come back to the you are a vocal athlete idea from before. An analogy that I use sometimes is, if you were a basketball player and you saw them twist, if you were watching it and you saw them twist their ankle on the court, you wouldn't immediately think like, oh, that basketball player's technique sucks, right? You would think like it's part of the sport. So if you ever do end up with a vocal injury, it's not because you're bad. I just want to put that out there because I think there's stigma in this industry that creates a lot of fear for singers. So we like to educate and normalize that, you may run into a problem at some point, and that's why we're here. So increased vocal dose can result in what we call phonotrauma, which is just a scary way of saying like something changes in the vocal cords. It can be from talking too long, too loud, not giving yourself enough recovery time. When you're in a really noisy environment, you're using more vocal dollars. We'll get to that analogy in a moment. And just compromised overall health. Like if you're actively sick and you're using your voice, that swelling in your vocal cords can result in an easier time being damaged. So vocal budgeting is just how you manage your personal vocal dose. You can take little voice naps throughout the day to allow for rest. Schedule your voice demands wisely, meaning if you know you're going to have a really high stakes performance, maybe you're saving a little bit of your vocal energy earlier in the day. Vocally expensive atmospheres I have more on in the next slide, but my general guideline that I tell people is 15 minutes of voice rest per hour. Ideally, not always doable, and it doesn't always have to be consecutive, meaning you could do like 3 minutes here, 2 minutes here. A vocally expensive atmosphere is just a place with background noise that causes an increase in your loudness. So think like a restaurant, a large gathering or a party, concert, talking over the TV. I have a relatively long commute to work, and I used to call everyone I know in the car and talk over the sounds of the highway until I realized that was just not a sustainable practice for me. So now I try not to do that, but I end up singing in the car instead. So I don't know if that's better. But the intention here is like far from creating like a laundry list of like, do this, don't do that, but just to be smart about thinking about how you're using your vocal budget. Here's my favorite thing and fun fact for people. So the Lombard effect is essentially the involuntary act of increasing vocal effort, raising your pitch and your loudness when you're in a noisy environment. There's a really awesome study from 2011. One of our mentors, Dr. Michael Johns, is part of it, where they found that if you use a single earplug, so not both because that's not really doing much for you, but a single earplug can give you better audio feedback of how loud you're being, and it can actually decrease your volume because we don't need to be as loud as we think we do. So that's just a fun fact. I do that when I'm at like concerts or loud bars.
I was really happy to see that Pizza Mania is still here in Fort Richards, by the way. Speaking of which, yeah.
So you all know about warm-ups. Another one of our colleagues' favorite quotes is repetition is the hallmark of learning. So when we do something many, many times and switch up or vary this practice, meaning like different environments, different times of day, turns out we get better at it. So we want warm-ups to establish comfort in our voice, figure out the desired technique we want to use, and improve the quality of our voice when we're doing that specific task. So we want to mentally prepare for what we have to do, meaning you're doing motor planning pre-performance and reestablishing kind of those muscle patterns that allow you to do what you do. Theoretically, like in athletic warm-up for someone who plays basketball. And you can also, they can look different than like skill acquisition, right? You're not trying to learn a new thing, you're trying to warm up your instrument. So they don't need to be wildly long, in my opinion. Apologies to any of the voice teachers in the room here who, if you do a long one, I don't know. But you can economize that with your vocal budget. So we typically tell people to begin with easier tasks before advancing to more skill-specific things. So a really general example is just kind of like feeling your body in alignment. Is there anywhere I'm feeling tension? Start with something gentle, lip trills, humming. Other semi-occluded vocal tract exercises was just a long way to say like smaller space for your air to escape. Mid-range, easy pitch contours. And then you can advance to, different ends of your range, more complex pitch contours or melodic contours, thinking about your task ahead. So if there's a specific part of a song that you're like, I want to make sure that feels good, do your lip trills to that part of the song. This is inspired by Vocalab AU, which is an account that I like to follow on Instagram. I'm not sponsored, I don't know her personally, but I think she's awesome. She's a singer, a voice teacher, and a speech language pathologist in Australia. So this is kind of her thing that we often steal. So pre-warm-up, no sound, any stretches that feel good for you, laryngeal massage if you know it, breathing, steaming, nebulizing, and then gently bringing some blood flow to the area, stretching your range a little bit with some humming, straw phonation, sustained, not necessarily vowels, but sounds. Sometimes we use consonants in voice therapy. And then more technical things, right? If you're working on something where you're mixing, belting through your passaggio, melismas, different dynamics. And then coming back to cool downs, which I think sometimes people neglect, but if you think about it, like if you woke up in the morning and went for a walk all day long and never stopped walking, kind of like how your vocal cords never stop working for you because they're part of breathing, and you didn't stretch after, like your hamstrings would be tight the next day. So you do want to stretch that as you come down, and think of it as coming back down to your normal speaking voice pitch. So the maintenance of a higher pitch after you've been singing really high for a long time can suggest, increased vocal tension beyond that performance. So come back to your baseline and just kind of reset a little bit. Being mindful about laryngeal irritants, I think that a lot of people love cough drops. I love a cough drop as much as the next person when I'm actually sick. If you're not actually sick, the menthol or mintiness can actually dehydrate you more and lead to just like irritation down the line. So switch to like Jolly Rancher or something like that. Allergies, smoking of any kind. We're throat people, we have to say it. Don't do that.
Never smoke. If you smoke now, stop smoking. I can talk to you more about this. If nobody else will tell you except us, don't smoke, don't vape, don't be around smoking or vaping.
No judgment though.
No judgment. No judgment. But as a laryngologist, I feel like that's my
just
soapbox.
stop doing
And
that.
sorry.
Acid reflux, some people are obsessed with this. If you feel symptoms of acid reflux, address it. If you don't feel it, don't worry about it. Alcohol and caffeine are just kind of one of those things where it's like if you're drinking a lot of alcohol or drinking a lot of caffeine, just like pair that with a little extra hydration. I always say like treatment can't be worse than the problem, so like don't feel like you can't do anything you want to do, but just like address it with some things to take care of your voice. And be mindful about what we call phonotraumatic behaviors. If you're shouting, it can be context and dependent. You know, if you're calling across the room in an inefficient way, it's going to put some strain on your vocal cords. If you're talking really loud, just plug a little earplug in. So use a mic if you need to. I know not all of you use mics. We're using mics right now.
So great.
On purpose. And then things like throat clearing. We talk a lot about it, and I think a lot of singers are like, oh my gosh, I can never clear my throat. Sometimes you gotta clear your throat. It's okay. We're not the throat clearing police, but if it becomes a habitual pattern where you're like all the time, every time you do that, your vocal cords are whacking together. And people are like, oh, I feel this mucus. And I'm like, yeah, so every time you do that, you're sending a message to your brain that's like, there's something irritating there, and your brain's like, perfect, I will send you more mucus to help you. So it becomes a little bit of an itch-scratch cycle. Whispering, this is one of our favorite things to debunk. True whispering does not involve vocal fold vibration. I'm whispering right now, nothing's vibrating. But if I'm going like this, that's straining my vocal cords a little bit. If you're really whispering, you probably actually do want the person to hear you, so just talking at a lower volume can be more efficient than genuinely whispering. So in the short amounts that you use it, doesn't really cause problems, but can be uncomfortable if you're using it with a lot of strain because you actually do want them to hear you. Vocal fry. People are really scared about this too sometimes. Generally, there's a lack of evidence, and I say it as like, if you're like this, it's just kind of like low flow. Are you damaging the tissue to your vocal cords? I'm not convinced by anything that we've read, but if your air's not powering your voice, something else has to, and it ends up being your muscles. So if it's contributing to vocal fatigue for you, then you can think about it not doing that, but if it doesn't bother you, it doesn't bother me.
All right, thank you, Casey.
That's the tea.
Yeah, and to talk about the smoking thing, I mean, thank you, Casey. I understand that, tobacco, vaping, all things, just really just don't do it. And you guys are using your voice as part of your livelihood identity. Let's just keep it healthy. Speaking of which, we're going to talk a little bit about vocal injury in the performer. Also going to hopefully debunk some widely held beliefs and help give you some at least concrete knowledge and empowerment and not fear. The point of this part is not to scare you or at all, just really to empower you with knowledge. As Casey mentioned, your voice, your body is your instrument. It is much easier to play and troubleshoot an instrument when you know and are empowered about how it works. And unlike our colleagues in the conservatory, we can't just buy another instrument if one is damaged. This came out of a article a long time ago, Chords of Steel. This is not what you want, right? We want nice vocal, flat, pliable, soft vocal folds, vibration, and we don't want chords of steel. You want vocal folds that are physiologic, and you're using well, you're hydrating well, part of your body and tissue with a little bit of forgiveness there too. Hoarseness. Hoarseness and laryngitis are not the same thing. They are unequal. Hoarseness is just a way to say that the voice sounds bad, and the way the term we use in medicine is dysphonia. Dysphonia is the medical term for hoarseness. Laryngitis, anything that ends in itis, means that there's some inflammation. Inflammation brings fluid to tissues, brings redness and warmth and pain often. So laryngitis tells us that there is inflammation of the vocal folds, which can also be associated with hoarseness, but they're not the same thing. And also, don't assume that hoarseness is like normal or just a part of like reflux or allergies. A lot of times, and not to discredit other ENT doctors who maybe don't have the like training or equipment to properly evaluate that, I think that sometimes those things are interrelated. And don't just think that it's related to reflux or allergies. Reflux or allergies by themselves do not cause voice problems, and that is something that we're trying to debunk on the bigger picture as well. Hoarseness by itself is often painless, and it usually does mean that there's something wrong, whether that's something at the level of the vocal folds or something at the resonating tract, something is wrong. So the American Academy of Otolaryngology Head and Neck Surgery says that if you are hoarse for more than 2 months, you should have a laryngoscopy by somebody who can provide that. I would up that and say you need a laryngoscopy with stroboscopy, which we'll show you here, which gives us more mucosal detail of the vocal folds to help identify problems. So part of our evaluation when we see somebody who comes in with dysphonia or hoarseness is first when you walk in the room and we start talking to you, listening. That's our primary diagnostic modality, is just by listening to somebody's voice. So different voice problems have different voice qualities that we listen for. So a raspiness or a roughness often tells us that there's something wrong with the vocal fold vibration. If there's breathiness or something like this, that tells us that the vocal folds are not coming all the way together, that there's some air escape there. Peculiar sounds can tell us that there is some uncoordinated or abnormal vocal fold motion. So there are neurologic conditions that cause vocal folds to spasm together or spasm apart, which can be really challenging to treat, but that is how that sounds. If I'm talking like this, my vocal folds are still fine. I'm just not using my resonance properly, and that placement of my voice is in the wrong spot, so altered resonance can cause a voice problem. Poor volume, like Casey was saying, impaired closure, or kind of a breathing balance problem. And then change in a pitch or decreased range can tell us a lot about the vocal fold pliability, stretchiness, like we showed you before, that has to like stretch and release to change pitch. So if you have some loss of some part of the range, there might be a reason why. So then we look, and we have a couple different ways of looking at the vocal folds. This is actually an old-timey pic of our mentor, Dr. Michael Johns, and Edie Hapner, who's a voice specialist, speech-language pathology. She's the queen. And this is a way of looking with a rigid scope through the mouth that gives us high mucosal detail. There's also a better and better technology with flexible laryngoscopy through the nose to take a 90-degree look down at the vocal folds to look for vibration there. Common things, if it feels good and there's no immediate consequences, what could possibly go wrong? So can I sing when things are going wrong? So the most common things that we see with hoarseness or dysphonia, the most common causes are first infection. Acute laryngitis is usually viral. So if you've had a bad upper respiratory infection, runny nose, cough, and you lose your voice, that's very, very common. It's likely a result of inflammation or of itis of the vocal folds. Also, typically these are viral and self-limited, meaning they'll go away on their own. You just have to kind of rest yourself, hydrate, take care of the whole instrument, your whole body. Sometimes, and in rarer cases, there can be infections by a fungus or bacteria, like a yeast infection of the vocal folds. But typically there are things that are also going on as a result of that, that are causing that. So also fungal or bacterial, most likely viral infections. But we can see that, we'll see some pictures of those examples in a second. There is then phonotrauma. Casey talked about that. Something wrong, something that has gone wrong with the vocal folds. We kind of divide this into acute and chronic. So acute phonotrauma can happen with what we call a vocal accident. You were at a Super Bowl party and you were screaming too hard for one of the teams. I don't do sports ball, but you were screaming really hard and you lost your voice in that second. That would be probably something like a vocal accident leading to acute phonotrauma. And we can see that happens with just edema. There can be a hemorrhage or a vocal fold bruise. And there can be mucosal tears or hemorrhagic polyps that come up. And then there's chronic phonotrauma, lesions. You may have heard of like nodules, things like that, cysts. These are very distinctly different categories, but do arise often when there's too much frictional force between the vocal folds. And that's typically something that has to do with muscle tension and an inefficient vocal posture. So nodules, polyps, cysts, scar. Yeah, please
Just
go
to add, I would say more than 80% of the time when we see singers, it's none of the above. And most of the time you just see me for some therapy and it's just muscle tension related. So this is not at all meant to like scare y'all.
Totally not meant to scare you at all. I'd say that is very true. And usually when there's some issues, it's, like I said, related to vocal posture and vocal efficiency. And that leads us to this. What else causes voice issues?
Sorry.
No, it's okay. Muscle tension dysphonia. So muscle tension dysphonia is kind of a broad umbrella term for inefficient vocal postures or inefficient voice use that leads to a voice quality sound problem. And we use this term because, like, for medical research and billing purposes, we have to like put people into like a diagnosis bucket, even though there's like a spectrum of problems. Muscle tension dysphonia just means like something's going wrong with the muscles to cause this voice problem. And then we talked a little bit about allergies. Local irritants can cause inflammation. We do see a lot of age-related voice changes, and I did mention some neurologic disorders. These don't apply to y'all. And then there are some other medical issues that can cause voice problems, like autoimmune disorders and, of course, cancer, which we also do see sometimes. So let me do some little fact or fiction, okay? And then, okay, I'll go on. The right gargle will make my voice improve faster. Who says that's a fact? Raise your hand. Fiction? Fiction?
Yeah.
Raise your hand for fiction. It's fiction, yeah. So as Casey said, anything you swallow, typically in a normal throat, will not contact your voice, and it will not help your voice improve faster. That being said, some gargling and cut bubble techniques can be helpful and relaxing. If I'm given steroids, oral or like a shot, I can use my voice and totally not worry about it. Raise your hand for fact. Some people believe this, and raise your hand for fiction. Yeah, not true. So steroids are very powerful and very helpful medications that I do prescribe pretty frequently for the right situation. And sometimes this can decrease inflammation, but it doesn't decrease the problem that caused the inflammation in the first place. So sometimes when folks have like a very high stakes performance, somebody needs to get through something despite having some vocal fold edema inflammation, we can use steroids in those settings. Voice use during viral laryngitis can cause permanent vocal fold scarring. True or false?
Raise your hand for fact.
Raise your hand for fact. Fact? That is a fact, actually. It is rare. It is very rare, but sometimes when your voice is so gone and it persists that way after a viral laryngitis, it is important that you get seen because we do treat this with voice rest and steroids. Again, not to scare you, it's very, very rare, but it is important to know that if you are sick, you lost your voice, maybe not a good time to like go to Port Richards and use your voice a lot.
Yeah, I think some people think that like nodules is the like worst possible thing that could happen to them, but actually that's not true.
That's not true, yeah. Vocal fold nodules are very manageable entities. Vocal fold scar is a lot more complicated. I could talk about that for a while too. We talked a little bit about this. Viral laryngitis is self-limited. We do typically treat this with voice rest and just treating your whole body. Fungal and bacterial laryngitis, that is a word. We do treat that with medications that are aimed at that. So just going to give you a couple of videos. This is what it looks like when somebody has an acute viral laryngitis. You'll see compared with the last video, the vocal folds are like really thick and kind of round and kind of what we call hot doggy. They look like hot dogs as opposed to like a nice vibrating surface. We literally use the term hot doggy.
We do genuinely use that term.
And see, the vocal folds are not like vibrating well together. They're kind of just like bumping up a little bit. There's some not completely coming together. This is what it looks like when you have an acute viral laryngitis. So we talked a little bit about acute phonotrauma from like a vocal accident, and edema and swelling is the most common consequence of that. But we do like to, when we see edema and swelling, we treat it the same way with rest and steroids and hydration, things like that. This is typically painless as well. This is something you can sometimes push through, but often should not. But again, conservative management, hydration, voice rest. Sometimes steroids, like I said, if you got to get through a performance at the Met tonight, we have ways of helping you getting through that. This is what this looks like. This is an acute swelling or edema after a vocal dose that was quite high in the setting of illness. You'll see that the bumps on the vocal folds in the middle, they happen in the middle here because that's where the vocal folds are contacting each other the most. There's the most frictional contact there between the vocal folds.
I will say some of that goopy stuff you're seeing is just mucus
Also
hanging out
mucus,
on those
yeah.
lesions, which it likes to do.
This is the same person like a couple days later, so. Take care of yourself.
Wow.
I know? Wow. Great, right? I did nothing. That was all the person. Let's see. Vocal fold hemorrhage. Again, it sounds terrible, hemorrhage, but it's actually just a vocal fold bruise. It looks kind of like this. It also has some implications in vocal fold vibration. So what happens is that, like all tissues of the body, there's tiny little blood vessels in the vocal folds that if something happens where there's an acute vocal injury or accident, this can happen. Again, this is very rare. I've now been in practice for about 3 years, and I've seen 3 of these come in after an acute vocal accident. So not something we see a lot, but something we can see, and it makes a kind of a dramatic picture.
Yeah.
And here's what that looks like. There's also some what we would call more chronic phonotrauma on the right vocal fold here.
It looks really scary, but it's not that scary.
It's not that scary. These go away, by the way.
It's like a bruise.
I have them come back in a week after voice rest, and I don't have the follow-up for this one, but maybe away. It's just like a bruise. Just like a bruise. And if they recur, there are ways we can manage that as well. So question is I have a bad voice problem and I have to get through this performance tonight. So there are what we call show-stopping injuries, and vocal fold hemorrhage and a mucosal tear are in that category where I would say if you want to preserve your longevity with your voice, it's something you should not perform on. But most other things that are much, much more common can be managed medically to get you through what you need to get through. We understand that this is a career important event. You got to get through it. That being said, this is a little plug for having a baseline laryngoscopy, just to know what your vocal folds look like, because if somebody comes in with a voice problem, we don't know how different that is from somebody's baseline. And we kind of talked about that too. Vocal emergencies. So again, vocal emergencies, this is a team-based decision, kind of going back to that first slide. How important is this performance, and can we get you through? Will it make a bad impact on your career if you sound bad during the performance? But really, this is, again, a discussion among all of us and not just the doctor telling you can't sing tonight. And then chronic phonotrauma. Belting causes vocal nodules. Raise your hand if you think it's fact. Fiction? Oops. Fiction? Yeah, it's fiction. You can belt efficiently. You totally can. Yeah. It does not cause vocal nodules, necessarily. Successful performers do not have vocal fold lesions. Fact? Raise your hand if you think it's fact. Good. Fiction? Total fiction. We see a lot of singers who come in and have a little bit of mid-membranous fullness in the vocal folds. We call these the dancer's feet. Yes. We call these the rock climbing hands. You use your vocal folds all the time. That contributes to your vocal voice sound. So when we see somebody who comes in for a baseline exam and they have just a little bit of a not perfectly straight contour of the vocal fold, that's not a problem. We don't treat the picture, we treat the person. And we treat the person's voice.
It's not a beauty competition on the inside, it's how your voice is functioning for you.
Sorry, throat clear, police. Chronic phonotraumatic vocal fold lesions require surgical removal. True? Who thinks it's fact? Okay, fiction? Correct, yeah. The vast majority of chronic phonotraumatic lesions do not require surgical removal. I love doing surgery. I went to school for a long time to do vocal fold surgery. I find it very rewarding, but I love not doing vocal fold surgery, especially when I don't have to. When Casey can really take somebody through a protocol to help get them through a problem. And then after vocal fold surgery, the voice is never quite the same. True? Who thinks it's fact? Okay, fiction? You don't have very much faith in me, okay. So it is true that there is always a risk of vocal fold scarring with any vocal fold surgery, but for the vast majority of my patients, they get better or have no problems that are undetectable after vocal fold surgery. I'll talk a little bit about, we'll just show you some pictures for the sake of time. Vocal fold nodules are, by definition, bilateral on both vocal folds. They are kind of just like the calluses, the dancer's feet, like we were talking about. If there's no voice problem when we see this, we just thumbs up, have a great show, no problem. Only manage if it's causing voice problems. These are just examples. A vocal fold polyp. Okay, this is not a singer, okay, y'all? What we love about singers is that you guys know your voice. You know when there's a problem, you come see us, we can identify usually something very manageable and treatable. Some folks are not singers and they have voice problems too. So this is a patient who came to see me years after notice. His wife actually brought him in. It's like, you gotta come in, your voice is messed up.
They are eating this up.
Don't you want to get in there and just like, me too. Me too. And this guy did great after surgery. This is actually not the same patient. This is a different polyp. So, I know. He did great. He did great. The polyp came off. It was great. This second picture on the sides of the slide is another example of a polyp. So polyps can range in size. They're usually on one side, can be on both sides, but usually just one.
And usually come from like a vocal accident. Nodules happen gradually over time, but if you get a hemorrhagic polyp like that, it's usually like, oh, I screamed on a roller coaster and then all of a sudden my voice changed, or like I shouted really loud and then all of a sudden my voice changed. So those are more of like accidents than nodules.
Right. This it's like a blister, kind of like have like you get a little bump from a blister, and there's like blood into it, and then it can kind of grow like that. So that was not a singer. Cysts also arise. These can be related to how voice is used, but not always. They can be inside the vocal fold or on the outside. We call them innies and outies. Generally, the innies don't cause as many problems. I know, I'm serious. This is really how we talk. This is what we would call an innie cyst, and this is an outie cyst. You can imagine that the one that's an outie is more likely to be treated well with surgery because we remove that lesion. The vocal fold is kind of better in contour. Whereas if this one we remove, there might be kind of like a little divot where the cyst was, and so we're a lot more careful, and maybe I would treat with voice therapy before then.
Yeah, and probably causes more problems, like depending how close to the free edge of the vocal fold that it is. Like this person on the left side of the screen may not notice that their voice is that different.
Mm-hmm. And scarring is what we fear. It's really one of the hardest things to treat in our field. It's where the overlying skin of the vocal fold or the epithelium is stuck down to the underlying muscle, so you get lack of vibration. And this is why we put folks on voice rest, and it is a hard thing to treat. We do manage with voice therapy, and there are some in-office and operative treatments that are available, but something we like to avoid.
It's a hard problem to treat because if you remember that cross section where there was the muscle and then kind of the jelly layers, a scar means the jelly layers are stuck to the muscle, so they're not vibrating the same way, and there's nothing that we have currently that really like mimics the jelly-like layer.
We're trying to inject stuff. We currently try like PRP. You may have heard that in like dermatology stuff. But it's a tough problem to treat. You'll see on this slide, this vocal fold is not vibrating well. That's the one that's pretty severely scarred down. And like that kind of high-pitched sound is kind of that air squeaking through. It's not vibrating. This is all to say that most of the time when we see singers and professional voice users, behavioral modification gets you through and helps sustain your instrument and empowers you to use your voice efficiently for the future. Medical management is sometimes required. Antibiotics, steroids, like we mentioned. Voice therapy goes hand in hand. I don't really know why that's a second bullet, but it should be up there. And then rarely surgical intervention. We train to do this because it does help a small percentage of people, but usually not. And then I'm gonna talk briefly. I'm gonna actually keep this very brief, but again, reflux, allergies, foods, environmental things. Like we talked about, your vocal folds, your larynx is inside your body. It's exposed to everything you're exposed to. So yes, there can be some contributors to throat irritation and discomfort by reflux, allergies, irritants, foods that disrupt some of your normal physiologic processes, but by themselves are not typically the problem when there's a voice problem. So don't fear. Vocal injury is common, always treatable with some combination of our services, usually Casey more than me, hopefully. And then many successful performers have seen us, and other voice professionals have had masses and injuries, more than you might expect. And then, like you said, like nobody needs a perfect vocal fold contour. It's really what is getting you to have the sound and voice that you want to achieve your vocal goals. And then, be careful, I would say, these videos that you've been seeing are video stroboscopy, so they're allowing you to see the vocal fold vibration. Most ENT offices in the world don't have that capability, and so I think it's important as voice users that you find somebody who can do that. And then establish care with a voice team, ideally before you have problems, so that you know where to go when you have one. And then I'll skip this. Surgery is really fun and cool. Again, most of you, hopefully none of you will ever need vocal fold surgery, but it is really fun. We can use lasers and tiny microscopes and tiny things. This is just some screenshots from vocal fold surgery. And then healing is all about how your body responds to the controlled trauma of surgery. And again, I don't want to scare you. It's vocal fold surgery is really amazing. People do usually have a really great outcome. We take really good care of folks together. And when I do offer laryngeal surgery for somebody with a vocal fold injury, we still work together for that recovery process and moving on with life and career. So, do we want to ask questions now? Q&A now, or do you want to just go right to the...
Do you want to see Dr. Schumann's larynx first and then ask questions? Okay.
Yahoo! Okay, great. I'm just plugging this in. We're going to do a little switcheroo. Before we do that, actually, yeah, this is all switched up.
Okay.
So I have these slides. We kind of talked about this already. Back in the day, before we had technology, people would use a mirror in the back of your throat to look with a light at your vocal folds. It's pretty creative, but it's not adequate. There are still ENT doctors out there doing this. To give you a little orientation of what we're looking at, again, the trachea is below and in between the vocal folds. There's an epiglottis here. Arytenoids open and close the vocal folds. And then a halogen exam is just a plain light exam. You can see most things, but you can't see how the vocal folds are vibrating. Sorry, cacophony. That vibration is really important, so that's what we will show you today. Okay. And we'll use a flex scope today just for ease, but we have both available.
Yeah.
Right, let's disconnect here. 1 sec.
We like the rigid scopes through the mouth for singers because they give us really close, high-def pictures. But if you want to sing while we're in there, we have to use the flex.
Oh, yeah.
Which you will.
I guess. I didn't prepare anything, actually, but...
Do you know some songs?
I know some songs.
How do I see what I'm doing? Oh, here.
There.
Okay.
I was like, this is my... Oh, thank you. Marcus just read my mind here. Marcus, my sister, Catherine Schumann, she's a soprano. She sings with the LA Master Chorale. She was Marcus's year at an undergrad here at Cal State. So again, family of singers. She's doing the thing now. Great. Can you see that? Sweet. Okay, my vocal folds are going to be so large and in charge. So excited. And just make sure the strobe is working. Can you go? So I sprayed my nose already with some numbing medicine and decongestant spray like a few hours ago. The decongestant is still there, but the numbing is not, but that's okay.
Is the light on?
Doesn't seem.
Great.
Great.
Okay.
So we call this our handshake. We do this to basically everyone. Do you want to bring this out a little closer?
Oh, sure. Can you be your own pedal?
Yeah.
Okay. Thanks.
Okay. Great. So if you want to talk them through what you're seeing.
Oh, sure.
Because I won't be able to see it very well.
Do you have a preferred nostril?
You can take a look.
Okay.
So all roads lead to the larynx. You can choose which side of the nose is more open. I forget which side mine is, but you can decide.
Cool.
Find out. All right.
We're going to peek in both.
Magic school bus time.
You
guys are too young for Magic School Bus. Wait a minute. Are you guys too young for Magic School Bus? Oh, okay. Thank God. Whew. Sometimes I date myself.
Okay.
Thanks.
So you're going to be your own pedal today.
Okay, great. So this is a combination of a plain light and then a strobe light. This is a microphone which picks up on the pitch that I'm going to be phonating at. That generates a strobe light that's out of phase when we get to the vibration portion.
Mm-hmm. Okay, so I'm going to peek in your left side for your right side. Everybody has nose hair.
Everyone has nose hair, not just me. They're normal.
Okay, so this side looks like not the path of least resistance, so I'm going to go in this way.
Okay, great.
So this is her nasopharynx here.
Kit Kat.
Go ahead and say Kit Kat.
Kit Kat.
So that's her soft palate moving and touch her nasal hair.
Coca-Cola.
Okay, breathe in.
Coca-Cola.
Okay, breathe in through your nose, put your chin up for me. All right, just to orient you here. The top of the screen is toward the back of her body. The front of the screen is toward the front of her body. Stick out your tongue for me. This is the base of her tongue. Lumpy and bumpies are normal. This little Pringle, you can put your tongue back in. This little Pringle-shaped piece of cartilage is her epiglottis. So when you swallow, you can swallow if you want, your epiglottis flops over your airway to protect it. And then you can see the two little white lines are her vocal folds, and then those little nubs, I can't point, are...
wait, you can turn this way.
Okay.
These are the retinoids, I think.
Yeah,
okay.
Those are the retinoids. Those are the cartilage joints that open and close your vocal cords, and then those little gutters on the side kind of direct food and drink to your esophagus, which she's going to show us. Yep, there it is. That little opening you see at the top, which is a flat tube unless you're burping or swallowing. So we're just going to get a nice close-up view of her vocal cords first, so just go ahead and breathe in. And there they are, and you can see a little bit of her tracheal rings in the back. All right, and go ahead and alternate between a sniff and an E. So that's how we check mobility of the vocal folds to see if they are moving normally, and hers are, which is great. Now what do you want to do?
Glide?
Yeah, glide from low.
Strobe next, okay. You can see how the vocal folds are becoming more tense in that sense. I know, right? Isn't this cool? All right, I'll switch to strobe. We're gonna switch to strobe. So the strobe light is, I'm gonna use this pedal to turn it on, and I'll hold out a nice modal.
High and soft. Good. Sorry.
That's right. You're a little close. It's all good.
I am. I'm a little close.
No,
I was trying
okay.
to show them close. Okay.
What should we? Is it strobe working?
Yeah.
Okay, great. What should we sing? Somewhere over the rainbow. Somewhere over the rainbow, way up high, there's a land that I heard of once in a lullaby.
Yeah.
I'm not gonna sing the whole thing for you.
Okay, do you want to do, I'm going to get close again.
Okay.
And then breathe in like you're scared. So you can see how we can see a little bit of like the underbelly of her vocal folds when she does that. And that's how we look for lesions. But luckily, Dr. Schumann is totally good-looking vocal folds
Good,
in
because
there.
when I was pregnant, I had a prominent blood vessel there.
It was actually the tiniest thing you ever saw, but she
I
was worried
stressed
about
it every day.
Okay, are you done?
I'm done. Great. Thank you. Sorry. No, thank you. Thank you. Casey and I actually teach a course on how to do this for voice specialists and speech language pathologists. I know it's a little after 12, but I'd love to take some time to answer some of your questions about this. Yeah, for sure. Thank you. Any questions about career stuff, voice stuff, health stuff? Yes, Christine. Hi.
Okay, a huge question, and hopefully this will help other people decide.
Yeah, of course.
But I have chronic postnasal drainage.
Yes.
I have been tested for allergies. I know
Totally.
nothing in the known universe. Seriously, nothing.
Totally.
I'm the only person I know who doesn't have any allergies.
That's amazing. You're not the only person I know, but I bet that's terrible.
Yeah, so I'm really not sure what is causing that.
Yeah.
And I drink plenty of water.
Totally, yeah. So this is a very common complaint that we see, and I'm really glad that you have gotten tested for allergies, because if we can identify something, so let me take a step back, is that allergy testing, which we offer to, is only as good as what you're testing for. So, medical science is amazing. I'm a total believer, and we should keep funding it. Anyways, we can only test for things that we can actually test for. So we can do our best to try to find things like pollens and grasses and leaves, but there's also just a million other things in the world. So your allergy testing has been negative, which is good. We haven't identified a trigger, but you may still have some like low level allergies that we just haven't identified. So in that case, sometimes when I see folks, usually that nasal drainage that you're feeling is normal drainage from the nose that's just a little too thick. And so sometimes it's a little counterintuitive, but what can be really helpful is like saline sprays in the nose all the time. We live in like basically a desert down here in Southern California, even though we're close to the ocean. So nasal saline sprays can be super helpful. I use them all the time. I have it in my car. And then sometimes allergy medications like Zyrtec, Claritin, even if you haven't been identified to have allergies, can be helpful. And the flip side of that is that can also be a little bit drying to other parts of mucosa, so it's a little bit of a give and a take. So it is irritating. You're not alone.
Any other questions? I saw your hand in the back.
Oh, yeah, sorry.
I think in a previous slide you said that autoimmune disorders can affect your voice.
Yes.
Is there like certain kinds of autoimmune disorders?
Yeah, absolutely. So there are a couple which are very classic, like granulomatosis with polyangiitis. Pretty rare, but people who have GPA know they have GPA. That can cause crusting and stuff on the vocal folds or below the vocal folds. Sarcoidosis is another one that we see a lot of. That's also an autoimmune inflammatory condition that can cause problems at the level of the vocal folds. Lupus is very common, one of the more common autoimmune conditions that we see, and does have some ways of presenting in the vocal folds, but certainly not everyone that has lupus has the vocal fold problems. Mm-hmm. So when we see folks, we like take a very detailed history, make sure we know what testing has been done, and what other things may be contributing. And we work very closely with other specialists, rheumatology in the case of autoimmune diseases.
Same thing with like rheumatoid arthritis can have things that affect the vocal folds, but we don't like having rheumatoid arthritis doesn't mean that you're necessarily going to see it in your vocal folds, if that makes sense.
Yes.
As a lifetime singer, you know that we start rehearsals always with a warm-up.
Mm-hmm.
Do you think that I should consider, or that other music educators should consider, a warm down or a cool down?
Yeah.
Totally. I know we're all pressed for time, but I think it's your.
We always are. But I know as a singer, when I leave a rehearsal, I cool down.
Totally. Either make it part of your thing, or emphasize the importance of it to everyone. If you don't have time for it, be like, hey, we didn't do that, but go do that, even if it's just in your car for like 2 or 3 minutes. Like my rule for myself, every time I get in the car, whatever song I'm listening to, I'm lip trilling to that song. That's like first song, lip trill.
I do a lot of like gentle laryngeal massage. You shouldn't be pressing hard. It's really very, very light massage on the extrinsic muscles here
If your
to
tongue
kind of calm things down.
If your tongue feels tight, I like to put the tip of my tongue behind my bottom teeth and go like this. That one feels good to me.
Like a nice base of tongue stretch. You can feel it, right?
Mm-hmm.
Yeah. So I think it's great.
Yep.
I'm interested in his career path. Well, where does one start and study psychology?
You are here.
Here you are.
I think, honestly, and I did want to mention this because I think it is really important. I think that we're both very, very passionate about like voice singing, voice use, and the kind of medical behavioral aspect of it. So I think that like, I wasn't sure what I wanted to do after high school. I came here, I auditioned, I got a scholarship for voice lessons like many of you. And I was like, great, I'll do it, we'll see what happens. And I knew like deep in my heart that I didn't want a life as like a freelance performer. But I'm so glad that I studied music performance. I'll tell you why. Music performance, it really helps you understand delayed gratification, hard work and accountability in ways that other undergraduate degrees do not. And I will tell you that I was more prepared for my post-bac program than my other non-science majors because I was like, they're like, we have to stay till 5? We have to stay from 8 a.m. to 5? And I was like, dude, we get to leave at 5? And there's not like rehearsals till 10? So like, I think that like just the commitment of a music degree, an arts degree program really does help. And I think that if you really come at it with a passion for what you're doing, it comes through when you apply for things like these programs in medical school. Everyone in my medical school application, Dr. Talberg wrote me a letter of recommendation for medical school. It all like is part of the story, and if it's part of your story, then you just go after it. And I'm happy to like talk to you about specific programs and stuff too anytime. My email address was up, maybe we'll put it up so you can see.
I think there are also like some overlap in prerequisites for both speech pathology and medical school. If you're like, I don't know which one, but I like both of these options. Anatomy 101, you're gonna have to take that regardless, so you could do that and see what you think.
When I was in these seats, I was considering medicine. I was like, man, it's gonna be too hard and too long. And so I ultimately thought to myself, I'm gonna be 30-something and a doctor, or I'm gonna be 30-something and not a doctor. And I was like, you know what? The time's gonna go anyway. Let's follow what I'm passionate about, what I wanna be doing. And I'm so glad that I followed that instinct and impulse. So it's very doable. It is a lot of work and a lot of time, but I've loved every part of it.
You had a question for a long time, sorry.
No, it's crazy.
I have a connective tissue disorder, and I was wondering if that has any effect on all of this.
I'm so glad you mentioned that. So I just gave a talk actually on Ehlers-Danlos and hypermobility spectrum disorders. So these are, actually I gave a whole talk on like TikTok diagnoses, which are like rare-ish entities that most doctors are just kind of like, probably not affecting you. Oh, we scope you and it's pretty normal, so like move on with your day. But I love kind of social media has been helpful in some ways of like really helping to solidify what patients' like symptoms are. And there's a huge article that just came out in medical literature about Ehlers-Danlos and hypermobility spectrum disorders and how the arytenoids may be a little bit more lax. People are more predisposed to laryngospasm, where the vocal folds kind of like slam together and stay that way, have an increased vocal range because they can sort of get more stretchy and pliable, but a little bit of less vocal stability. And so that's kind of the underlying, that's how I approach patients with this. Unfortunately, the treatment is not amazing, but our voice therapists can be really helpful in managing.
Not amazing.
No, sorry. The medical treatments that we have are imperfect and underdeveloped, and we're bad at even diagnosing things like Ehlers-Danlos and hypermobile disorders. And so anytime I can't offer anything medical or surgical, Casey can offer lots of things. I think everyone would benefit from voice therapy.
Yeah, you do.
If I haven't made that clear.
You do think that.
I do think that.
I would say though, like, don't think that if you have EDS, it means it's going to impact your voice. Like many autoimmune conditions, it can show up differently for different people. So, kind of like, if it's not bothering you, it's not bothering us kind of thing. But if you're noticing things and you're wondering if it could be related, it could be a reason just to come see us, just to take a look so we have a baseline. And like, if there are things you're noticing, you know, from a rehab perspective versus habilitation, like with a voice teacher, we can give you just some tools in your toolbox to have kind of up front. So that could be an option too. Yes?
So how do we as seniors do our best to avoid laryngospasm? Because this happened to me before at the worst time, and then when it happens, you feel like you're gonna die.
Yeah, it's scary.
Yeah. I always say, I mean, if I could find a way to prevent people from getting sick, like a viral illness, I would be like super wealthy and probably retired by now. Unfortunately, that's not something feasible, but what you can do is take care of yourself. I know it's hard and you guys are all really busy, your time is very limited, but sleep, hydration, masking if you're gonna go on an airplane. I know it seems like a little bit overkill, but I think that COVID, for all the bad things, has sort of normalized masking if you're like trying to take care of yourself. That really does reduce the risk of viral transmission of things like, you know, viruses that cause upper respiratory infections, but they do seem to come up right before you really least expect it and when you can't really tolerate it.
You're mentioning laryngospasm.
Oh, laryngospasm, sorry.
So it's okay. So I think that, you know, identifying things that trigger you for laryngospasm can be important and just kind of like avoiding those things on performance days. But also there are some breathing strategies, right? Because the laryngospasm, essentially what's happening is you're trying to breathe in, which should make your vocal cords go like this, but they're going like this. So it can be really scary and feel like you can't breathe because your vocal cords sit on top of your airway like little French doors. So you might hear like a, and that's what happens to you. Yeah. So you have to breathe in against resistance, like in through your nose, or like you have a pretend straw, and out on a shh or a also against resistance, and just do that until it goes away. Yes.
Sorry, I totally misheard you.
Age-related changes in like vocal quality?
Oh, good question. So
Yeah, go ahead.
I'm my friend.
Yeah,
Hi. So when we want our vocal cords to come together all the way, sometimes as we age, our vocal cords get skinnier. So think about it as like a little bowing effect. So maybe they're not coming together all the way, and voice sounds a little bit breathier because there's a little bit of air escaping. But I will say for people who use their voice a lot, it's a little bit of a use it or lose it kind of thing. So like we see people who retire and like maybe don't use their voice anymore. But if you're like still singing, like I know 80-year-olds who have no vocal fold atrophy. So yeah, use it or lose it.
A very common thing we see is like when folks who are like, a teacher and then they retire and they're not using their voice as much, they're a lot quieter, they're not, utilizing those muscles, and so they tend to kind of get a little weaker.
Yeah, just like you couldn't, like, if you were 50, you probably couldn't run a mile the same way if you were 17. Yes?
I was wondering, like, as a vocalist, should we be going to, like, vocal therapy, like, once a year? Like, should that be something, or just when we're, like, feeling, like...
So I think that it's helpful to establish a baseline video stroboscopy. This is all covered by insurance, by the way. I know that in the past there have been laryngologists like me in the greater LA area who don't take insurance, but this is like medically necessary and covered by most insurance policies, by the way. At least at our center, we take insurance. That being said, I do think it's helpful to establish a baseline exam so that we know how to compare things when things go wrong. And a lot of folks we see are touring, they're all over the place, so we can put it on a thumb drive for you. You can take a video on your phone so you know what your vocal folds look like in a healthy, steady state, so that when things go awry, we can compare it. And then you want to talk a little about the voice therapy need?
And just to say, just like the ballerina feet analogy, like it's hard for us to know sometimes when we see you for the first time when there's already a problem. We already have that bias of like we're looking at if there's a little bit of fullness in the mid-membranous portion of the vocal folds. We don't know if that's your normal or not. So I agree with Dr. Schumann. Like get a baseline if you care about your, if you're worried about your vocal health at all. So for voice therapy, doing it like once a year, most people, it's not the same as a voice teacher where they see me like once a week or whatever it may be. Most people see me for 4 to 6 sections, like max, more or less if you need it. But if people aren't having a problem, then I normally am like, you don't need me. But if they are having a problem, I want to give you a toolbox. And my goal is not for me to be like, come back and see me in a year. My goal is for you to be like, now I know if I run into this again, I know what to do, and I feel independent in doing those things. But of course, I'm always here if you need me, but it's not quite the same like journey as working with a voice teacher.
Yeah. Yes, yeah.
What is the difference between when you get a stroboscopy? What is the difference between getting it in the mouth and the nose? Is there a difference, or is it just?
Good question. So yeah, it's different based on like, the route that we go. Obviously, this was a flexible scope through the nose. The advantages of the flex scope is that you can see how somebody is using their voice, talking, swallowing, as they would more physiologically be. We didn't show you the rigid scope, which actually I tolerate better than that. We have to pull out the tongue and then bring a rigid scope through the mouth, kind of like a toothbrush. It's a little bit more, can be potentially more gaggy, but not always. It gives us higher mucosal detail of the vocal folds. Like a lot of the videos in that first video I showed you was a rigid stroboscopy. As our technology and camera technology gets better, the flex scope approaches the higher resolution mucosal detail of the rigid, but we still get better pictures through the mouth. But it's a little bit less functional or physiologic. So.
If someone has just solely a voice problem, we like the rigid through the mouth, but if we're worried about certain things, or if they also complain of swallowing or like cough, then we take a look at the flex.
Or like postnasal drip, things like that, we can look through the nose. Go ahead.
Are there any studies that have shown like that the shape of your vocal cords or like your vocal system affects what kind of singer you are, like if you're better at certain things?
People ask this question a lot, and I think that the conclusion of a lot of these studies that have been done, like lots of voice centers like ours, they exist all over the country. They're affiliated with like young artist programs, things like that. So we have studied singers and studied singers' larynges, but I think that like a normal singer larynx with it looks like the normal like non-singer larynx, and so there's a lot more to it that we haven't really ironed out, and we really haven't been able to like nail down what's the singer larynx and what's not, or like what your voice part's going to be and what you're not, what's not.
Yes.
And like manipulating different sounds that are otherwise like like growling while you're singing or like grunting while you're singing, can that create like permanent damage or like bruising permanently? I don't know.
I love this question. So I work with a lot of voice actors who have to do kind of like, I can't do it. But
Video game, like
yeah,
ogre,
like ogres, monsters, that kind of thing. And oftentimes when you're hearing that, it's not actually their vocal cords that you're using to vibrate. Or even people, I've worked with an actress who had to scream on stage and was worried about that kind of like for her vocal health. And we can find like other areas along the vocal tract to vibrate. So I'm trying to do it. I'm really bad at it. So if I sound like this, it's not actually my vocal cords. It's my false folds, which sit above my vocal cords. So yeah, that's super fun to work through in voice therapy. Yeah, but overall, like, could it cause permanent damage? Like, if you're doing it in a way that's not healthy, sure, but overall, we can work around those things. Any other questions? Yeah.
What about like people who are transgender and how like they transition to like one to the
Yeah.
other? What would you say like for finding their voice
Mm-hmm.
and like because that's a part of like gender affirming.
Totally.
What's your advice on that?
I am so glad you asked that question. We are incredibly proud to offer gender affirming voice care at our center, and it's a diamond in our care plan. All of our providers, our laryngologists and speech therapists, are trained in gender affirming voice care. And USC as a whole has been really supportive of our gender affirming care program in general. And we are here to help folks meet their vocal goals and find themselves in their voice. And it's tricky because testosterone, or T as it's known, it does have irreversible effects on the vocal folds. And so it changes the vocal folds at the time of puberty in an AMAB individual, and it causes irreversible damage, or not damage, but like swelling and size changes of the vocal folds. And so typically for our trans masc patients, testosterone can be very helpful in achieving voice goals. And in our trans femme patients, making the voice higher in pitch can be a little bit more tricky, and there are surgical options that we offer to help achieve those goals. That being said, voice therapy can help the vast majority of our trans folks meet their vocal goals and find their identity in voice.
Yeah, I would say that, for trans feminine patients, the surgery is either something that they're like, they come to us like, I know I want this, or they come to us just kind of exploring their options, or they come to us, I know I do not want this, because maybe, they're trans feminine, but they want to continue singing baritone in their choir, or whatever it is that they're doing. So I would say, similarly to how I'm rarely singing in voice therapy sessions for singers, I'm rarely talking about pitch in voice therapy sessions for my gender affirming clients. So I think that, the pitch elevation surgery that Dr. Schumann can do is really awesome, but it's just one puzzle piece of the voice, and we counsel people a lot on that, right? So if you're just altering pitch, it's not necessarily changing things like resonance, airflow. I describe it as like a little DJ switchboard, right? There's so many puzzle pieces that go into voice, so we kind of play around with those things as well. And we can do that with or without surgery. So it's not totally different than voice therapy for any other type of patient that I see.
And then one more question about that, because I have done research on like the voice surgery.
Yeah.
How does that affect the voice like as a singer? And,
Good question. So you're talking about pitch elevation surgery. So at USC, we offer two different types of pitch elevation surgery, the Wendler glottoplasty and LAVA, and they can happen together. We can talk more about this another time, the details. That being said, anytime we're changing the length of the vibratory segment, the trade-off is pitch access. So in our trans femme patients, we can higher the fundamental pitch, so people are speaking at a higher pitch, but there is loss of the lower range because we are physiologically changing the structure of the vocal folds. The other important trade-off is volume. So we're changing the size of the vocal fold, and so that comes at a trade-off of decreased volume. And just like we have to relearn a new instrument when we surgically alter the vocal folds. And people do very, very well with a combination of pitch elevation surgery and therapy. But the therapy part is so important because we are completely altering what's going on here. The instrument that's been in place for most of a person's life and then now is a little bit different, but it's something that we are really passionate about and offer.
Yeah, and I will say, if you think about like before surgery, your range is this, we're not elevating the ceiling, we're elevating the basement. Yeah.
So if you like notice when you're singing you have like a lot of tension in the throat, how would you recommend like
I love this question. So again, you're vocal athletes. So feeling engagement of the muscles is normal. Not all muscle engagement is bad. But if it's to a point where it's causing you pain or fatigue, then I would say it's a reason to come see us, because I will not do voice therapy with someone who's not seen their vocal folds. So yeah, I mean, just like if you like ran a mile, you felt out of breath, you wouldn't be like, something's wrong with my lungs. You'd be like, I just ran a mile. So similarly, if you're singing a lot, like there's gonna be some muscle stuff going on in your neck there. Yeah.
Maybe you have time for one question. We're approaching our time. Okay.
Yes.
Well, not so much a question, but
Yes.
Dr. Schumann and Dr. LaForest, something that I
No.
really appreciated about your presentation today, and the voice faculty especially, we've sat through more than one of these seminars, and it's wonderful to see how the research has developed, even within our lifetimes. Every seminar we see, it's like there's more and more research that's coming out. So thank you so much for sharing that.
Thank you.
But I also really appreciate the fact that you're not one of the presenters, and we've all faced it, some of us know, that treat the vocal cords as if it's like something so delicate and so fragile, which it really is not. It's really, it's strong.
It's resilient.
And it's used 24/7.
Totally.
And I think that's something that's really important to take away from this seminar, is that your instrument is not delicate, it's not fragile. That being said, of course, you take care of it.
You take care of your Porsche, but it's a powerful instrument. Sorry, I don't mean to put, just a little jealous, that's all. But it's powerful. It's powerful, it's resilient, it's amazing. It allows you to achieve amazing artistic feats and sing over an entire orchestra. That's a miracle of just like physiology. Yeah. It's not a tiny little thing in a glass pedestal. You use it, just use it well.
And there are other subsystems of your body that contribute to voicing too. So it's not all the energy that you require for your voice doesn't come from here. It's like a whole body thing.
Totally.
And I think, if I may add, and I hope you agree with me, I think you will, perhaps for a singer at least, the single best thing you can do for your vocal health is to develop a sound vocal technique. Yes, and thank you, voice teachers.
Yeah, absolutely. No, and that's why we include the voice teacher, vocal coaches in our team, because we talk directly with our voice teachers. We make a plan together because nobody knows your voice teacher, your voice and your voice journey if your voice teacher if you're working with one, and it's really, really tremendous. Personally, I've learned so much from my voice teachers, and developing good technique, good resonance, efficient vocal postures helps you so you don't ever have to see us ever.
Yeah, and it's a totally different relationship. Like growing up, if my voice teacher told me to stand on my head while I was eating an apple, I would do that. And I'd be like, absolutely. So a lot of the voice teachers that we work closely with have our personal phone numbers. We talk about people all the time together. So.
With their permission. Protected by
we talk about you.
Yeah.
But yeah, I would say it's a totally different relationship that's more long term than what we offer. So y'all know your students better than we do.
It's true.
Yeah. Can we thank everybody?
Are here. Feel free to email with questions. Dr. Talbert knows how to get in touch with me, so let me know if I can help at all. So happy to be here. Thanks for having us.